My name is Oberita Makusisochukwu, a 100-level healthcare management/nursing student of JPTS Institute of Management, Science and Technology, in collaboration with South American University, USA, Global Welch University, Togo, and Pan American University, California. I will be presenting a seminar on the theme, the presence of hepatitis B envelope antibody in patients who have been previously screened for the surface antigen. Firstly, what is hepatitis B? Hepatitis B is a sickness caused by the hepatitis B virus. This is a virus that attacks and affects your liver. It can also lead to total liver damage or failure, which can also lead to death. The hepatitis B virus was first found in the year 1965 by Dr. Brauch Blumberg. 4 years later, in 1969, he created a vaccine. Then, in 1981, the Federal Drug Administration, that is the FDA, approved the vaccine for medical and commercial use. Hepatitis B virus has so many symptoms, such as yellowing of the skin and the eyes, extreme fatigue, loss of weight, nausea, etc. It can be prevented by vaccine and by making sure that you practice safe blood transfusion. Hepatitis B is mostly spread from mother to child during childbirth. It can also be spread by unprotected sex, sharing of IV needles, and sharing of personal items with an infected person. The hepatitis B virus can last outside the body for at least several days. The incubation period for the hepatitis B virus is 30 to 180 days. When a person is infected with hepatitis B virus, it takes up to 30 to 60 days to be able to determine if the virus is actually in the person's bloodstream. Now, what are antigens and antibodies? Antigens are foreign substances such as microorganisms, bacteria, fungi, or chemicals which invade the body. When the body is exposed to antigens, the body produces antibodies as part of its immune response. Antibodies are proteins produced by the body that binds to the antigen in the body to try and clear these antigens from our system. Hepatitis B blood test is a test that looks for antibodies and antigens that are specific to hepatitis B in the body. There are 3 different types of screening tests that are done to determine if a person is infected with the hepatitis B virus. The first test is the hepatitis B screening surface antigen test. This test is done to determine if a person is infected with the hepatitis B virus. If the test should come back positive, that means the person is infected and can transfer these diseases to anyone who comes in contact with his or her infected blood. The second test is the hepatitis B screening for the core antibody test. This test is conducted in order to know if the person is infected with the virus. And if it comes back positive, that means the person is infected, but it doesn't tell us if the person is immune to the virus or if it has become chronic. But if a period of 6 months pass and the person is still infected with this virus, that is, if the antigens are still found in the person's bloodstream, that means the person is getting to have a chronic hepatitis B disease. And the third test is the hepatitis B screening for the surface antibody test. If these tests come back positive, that means that the person has developed a lifetime immunity to hepatitis B virus. So basically, what I'm saying is, if there is a presence of hepatitis B envelope antibody in someone who has been previously screened for the surface antigen, this simply means that the person now has immunity from the virus. Hepatitis B is a very deadly disease, and we should all be careful about how we share our personal items and use sharp objects to make sure that we do not get this infection unknowingly. Thank you.